come closer to the fire. It's cold tonight. I want to take you back to a specific night in California, February 19th, 1994. To the outside world, it was just a normal Saturday in the city of Riverside. But inside the emergency room of Riverside General Hospital, something was happening something that science still can't fully explain. Usually, an emergency room is a place of controlled chaos. Doctors shouting orders, nurses moving fast. But on this night, the chaos wasn't controlled. It was a nightmare. Within the span of 30 minutes, seasoned medical professionals, people who have seen blood, death, and disease every single day of their lives, began dropping like flies. They weren't just fainting, they were seizing. They were paralyzed. And it all started with a single patient. This is the story of Gloria Ramirez, the toxic lady. Let's step into that hospital room. It is 8:15 p.m. Paramedics burst through the double doors. On the gurney lies Gloria. She's only 31 years old, a mother of 2, but she is dying. She has late-stage cervical cancer, and tonight her heart is failing. Her breathing is shallow and rapid. The medical team swarms her. They are trying to stabilize her. They inject her with drugs to calm her heart rate. They are bagging her to get oxygen into her lungs. So far, everything is normal. This is just a tragic medical emergency. But then, the atmosphere shifts. A nurse named Susan Kane is standing over Gloria. She leans in to check the patient's vitals, and she notices something strange. Gloria's skin, it's covered in an oily sheen. Not sweat, oil. Susan leans closer. There is a smell coming from Gloria's mouth. It doesn't smell like sickness. It smells fruity, like garlic and grapes mixed together. Susan shakes it off. She has a job to do. She grabs a syringe to draw blood from Gloria's arm. She finds a vein. She pulls back the plunger. The vial fills with red blood. But as Susan holds the vial up to the light, she freezes. Floating inside the blood are particles, little white specks. They look like crystals. She hands the vial to the respiratory therapist, Maureen Welch. "Look at this," she says. "What is that?" Before Maureen can answer, Susan Kane turns pale. She sways, her eyes roll back, and she collapses hard onto the floor. The room stops. A doctor, Julie Gorchynski, runs over to help. "Get her out of here," she yells. They drag the nurse out of the trauma room. Dr. Gorchynski takes Susan's place. She looks at Gloria Ramirez. She looks at the blood. And then she feels it too. Her face starts to burn. It feels like her skin is on fire. She leaves the room and walks to the nurse's station. She tries to sit down, but her hands start shaking. Not a little tremble. Uncontrollable shaking. And then, right in front of the entire staff, Dr. Gorchynski stops breathing. She collapses. That is 2 people down in 5 minutes. Maureen Welch, the respiratory therapist holding the blood vial, she is the 3rd. She feels her limbs go heavy. She can't move her arms. She passes out. Panic erupts. This isn't a heart attack anymore. This is a biological weapon. Someone screams, "Get everyone out!" They evacuate the emergency room. Imagine that. A hospital evacuating its own emergency room into the parking lot in the middle of the night. Patients on gurneys are wheeled out onto the asphalt. Nurses are ripping off their scrubs. Inside Trauma Room 1, a skeleton crew stays behind to try and save Gloria Ramirez. They fail. At 8:50 p.m., 45 minutes after she arrived, Gloria is pronounced dead. But the horror story, that was just beginning. The fallout was immediate. The hospital was locked down. A specialized hazmat team arrived, men in full moon suits, yellow rubber, sealed tight. They treated Gloria's body like it was a radioactive core. They searched the air vents. They searched the drains. They were looking for a gas leak, a toxin, anything that could explain why 6 hospital staff were hospitalized and 23 others were sick. And they found nothing. The official autopsy was conducted days later. The pathologists wore airtight suits. They worked in a special sealed chamber. And you know what they found? Nothing. Gloria died of kidney failure caused by her cancer. No poison, no gas, no explanation for why her blood smelled like ammonia or why it had crystals floating in it. So, the authorities came up with a theory. And honestly, this theory made the victims angrier than the incident itself. The health department released a report saying it was mass hysteria. They claimed the nurse, Susan, smelled something funny and fainted from stress, and when the other staff saw her fall, their brains tricked them into feeling sick too, like a domino effect of panic. Now, Dr. Gorchynski, the one who shook uncontrollably, she heard this report and she was furious. She said, "Mass hysteria?" Because, you see, Dr. Gorchynski didn't just faint. She spent 2 weeks in the intensive care unit. She developed hepatitis. She had breathing tremors. And most terrifying of all, her bones started to die. She developed something called a vascular necrosis in her knees. The blood supply to her bone marrow was cut off. Her legs were literally rotting from the inside out. Mass hysteria does not rot your bones. So, if it wasn't hysteria, what was it? Years later, a team of researchers at the Lawrence Livermore National Laboratory, a place that usually deals with nuclear weapons, took a look at the case. And they found a theory that actually makes sense. It's complex, so listen closely. Gloria was in pain, incredible pain from her cancer. The researchers believe she was using a home remedy called DMSO, dimethyl sulfoxide. It's a gel. Athletes use it for muscle pain. It smells like garlic, and it leaves an oily sheen on the skin. This explains the smell and the grease Susan Kane saw. But DMSO isn't poisonous. So what happened? When the paramedics picked Gloria up, they gave her pure oxygen. The theory is that the oxygen combined with the DMSO in her body and changed it. It added an oxygen atom. It turned DMSO into dimethylsulfone. Now, dimethylsulfone has a unique property. When it gets cold, it crystallizes. Remember the blood vial? The room was cool. The blood was drawn out of her warm body into the cool air. Those white specks Susan saw? That was the chemical crystallizing instantly. But crystals don't make people faint. Here is the final deadly step. The medical team was giving Gloria electric shocks with a defibrillator to start her heart. The Livermore scientists believed the electricity broke down the crystals and changed the chemical structure one more time. It turned dimethyl sulfone into dimethyl sulfate. Dimethyl sulfate is a gas, and it is not just any gas. It is a powerful chemical weapon. It kills cells on contact. It destroys the lungs. It causes convulsions, and it causes delirium and paralysis. In that small trauma room, as they pumped Gloria's chest and shocked her heart, they were essentially turning her body into a chemical factory, pumping nerve gas into the air. The nurse, Susan Kane, was leaning right over the blood. She took the first hit. Dr. Gorchynski was next. It explains everything: the smell, the crystals, the shaking, the bone death. Of course, Gloria's family denies she ever used DMSO, and the coroner officially lists her death as natural causes. But the saddest part of this story isn't the chemistry. It's Gloria. She died surrounded by people who were terrified to touch her. After she passed, her body was sealed in an airtight aluminum crate. Not a coffin, a shipping crate. She wasn't buried for 2 months because the county was too scared to release the body. In the end, the toxic lady was just a woman in pain who became the center of one of the strangest medical mysteries in American history. The next time you walk into a hospital, take a deep breath and hope that the air is clean. Thanks for listening. I'll see you in the next one.